Hi, everyone. My name is Annie. I'm a dermatologist. I'm based in Toronto, Ontario. I practice all different types of dermatology, medical, surgical, and cosmetic. I do have a special interest in skin of color, being a person with skin of color myself. And I think that this is a really special area of dermatology because they're predicting that by the year 2040, over half of the North American population will have skin of color. So just practically speaking, this is just something that's really important that not only physicians have to train for, but we have to be aware of as a community. So I'm really excited for what's to come in this area of dermatology and happy to be here today to answer your questions.
Hi, Dr. Liu. How do you counsel your patients in regards to sunscreen usage?
So there's usually a few things I talk about because it's unfortunately not as simple as purely just slapping it on. In terms of sunscreen, you definitely want to have broad spectrum and SPF 30 minimum. It's not necessary to have like SPF 100 or 60. There are diminishing returns for the sun protection you get for that increased price, but SPF 30 should be fine. But then beyond that, it's about applying it properly too. So every 2 hours when you're outdoors, and of course, if you're having any like regular sweating or water activities, it needs to be water resistant. And then sunscreen goes hand in hand with so many other protective behavior patterns. So avoiding peak hours, so avoiding 11 a.m. to 3 p.m., and then using sun protective clothing and other garments. So hats, where possible. I know it's uncomfortable in the summer, but long sleeve shirts, pants, it all goes hand in hand. Often it's hard to just rely on sunscreen as a fully protective measure.
Thank you. How do you counsel your patients in regards to self-monitoring?
So I think it's a good idea to monitor on somewhat of a regular basis, but it's not necessary to do it so often that it causes undue anxiety or worrying. And it should be tailored to your level of risk. And a part of that is dynamic and it may change over time. But I would say it's a good idea to do some self-monitoring once every few months. And what that means is just being aware of your types of moles or skin marks, and then doing a scan of your body. And that often involves the help of a householder or a family member or a friend, especially for the back, which you can't really visualize. But sort of doing a scan of your own body, front, chest, back, arms, legs, everywhere. And what's best is to take photographs of the moles or spots that you and your doctors are most concerned about. And obviously that means clear, well-lit photos, ideally with a small coin beside it, because otherwise there's no reference in terms of is it growing or changing. But yeah, once every few months with the help of a householder or family member with good photographs.
Perfect. What would you share with other dermatologists to support them in their clinical work with skin of color patients?
I'd say I think it's really helpful to get good training and to get good exposure. And a part of that, it's hard to control because certain curriculums are, very full, and there's not always like once the training is done, it's done. But I guess it's also about doing ongoing learning, going to conferences, going to meetings where there will be people presenting on skin of color, the latest therapeutics or diagnostic options, and just keeping up to date. And then in terms of exposures, at our particular practices, the types of patients, their racial backgrounds may be fairly fixed, but keeping an more open mind for patients with skin of color because their dermatoses or skin cancers may present very differently. So having a higher threshold to biopsy or investigate in patients with skin of color.
Thank you. What are the next steps or therapeutic options for patients with conditions such as acrolentiginous melanoma or subungual melanoma?
Definitely to get yourself seen in person by a dermatologist. It sounds simple, but when dermatology services are very limited, it can be quite a challenge even to like get that referral. And I think the best thing you can do as a patient is to really advocate for yourself, really push for it, ask for the referral. And then when you're booking your appointment, some practical things to keep in mind, like don't be afraid to mention how concerned you are, the specific aspects of your concern, if things are growing, any other symptoms you're really worried about, because medical offices usually are trained to do what's called triage. So they will usually be able to let patients with more urgent concerns be seen sooner. And certainly skin cancer concerns are definitely more urgent. So don't be afraid to speak out, advocate for yourself, but definitely it just involves being seen in person by a dermatologist, because there's things in person that need to be done. So they need to look at it up close with a device called a dermatoscope, like a small microscope. And then ultimately they may need to take a sample of it. So definitely be seen in person.
Thank you. How can we advocate for our skin of color patients moving forward?
I guess it will probably involve a lot of different things at a lot of different levels. And first off, to establish that I think this is definitely a priority for dermatology. I was at a skin of color conference recently, and there was a statement that was left a very profound impact, I think, on a lot of people, that they predict by the year 2040, more than half of the North American population will have skin of color. And naturally, as our world becomes more global, I think this is not surprising at all. So we have to be able to respond to changes in our world. And I think that we really need to empower our patients, because it starts with them getting themselves into our office, being seen by us, getting that referral. So I guess on very widespread levels, it'd be helpful to have campaigns, educational campaigns, about what to look for skin cancers in patients with skin of color, and then representation by individuals with skin of color at various levels, whether that means social media or various political frameworks. But basically, I think it's all about advocating for our patients so they have a voice and they know what to look for and are better represented.
Thank you. A little bit similar question, but how do you feel that the field of dermatology has evolved in recent years to encompass individuals of skin of color?
I think it really evolved a lot. I think they have incorporated things on many levels. I'm a fairly recent dermatology graduate, and in my training, there was aspects relating to skin of color. So it starts there at the training level, exposing the trainees to patients, to different presentations, different treatment options. And then beyond that, I've seen it evolve in conferences where there's different sections and talks to represent this area of dermatology, as well as even societies, not yet in Canada, but outside of Canada, there's skin of color societies where people can come and present and discuss and really innovate, as well as even things like fellowships, like advanced training in this area. So definitely it has evolved. I think we still have work to do, though.
Thank you. What are some factors that have contributed to existing disparities in melanoma outcomes for patients with skin of color, and what can the medical community do to address them?
I think the biggest issue is access. We know by data that acrolentiginous melanomas, when they're discovered, they're always much more advanced than their counterpart melanomas that occur on Caucasian skin. So it means that they're discovered later, which means that the patient got to the dermatologist later than they ideally would have. And that affects everything. They have more advanced disease then, and that requires more extensive treatment, and their outlook and prognosis is likely not as good. So I think access is almost everything in medicine. If you can't get seen soon enough for things that are very potentially dangerous or emergent, then your outcomes will be gravely affected, literally day by day, month by month. So that requires a lot of systemic overhaul, but improving access is a huge thing. And I think that means prioritizing like which patients get seen in person versus potentially using another method like virtual care to help save space for those patients that really need to be seen in person, like skin cancers, like acrolentiginous melanomas. And then on another level, just advocating for patients, like giving them a voice and awareness and like system literacy so that they know what to ask for. They're not too shy to ask for it. They know what to look for because it starts at the individual. So I guess through two ways, by improving access and then giving patients a voice.
Thank you so much. One final question. What message would you like to send out to skin of color patients with respect to dermatology?
I guess my message is to have good awareness for your own skin concerns and baseline levels for your skin. Because in some ways, it is a little more difficult to detect certain skin conditions in skin of color. And if you can have a voice for yourself, advocate to be seen by a dermatologist, and even when you're seen, you can come prepared with like photos of how your skin has changed, what it looked like at baseline, like originally. That can really make a big difference in your diagnosis, your treatment. So don't be afraid to really advocate for yourself. A lot of improvements have been made for skin of color, like the world of skin of color and dermatology, but there still needs to be a lot of advancement. So in the interim, it's important that you also take charge as well.
Thank you so much.